It's not right there. Should we turn the computer on so that it's easy? What do you think? Let's turn the computer on so that the camera, people are. Wait, we don't.
Good morning, everybody. How are you? You recording?
Yep.
All right. Welcome. Thank you guys for joining us this morning. Welcome to our calendar year 24 application for funding. This is our bidders conference. Why do you look so familiar?
I used to work for South.
Oh, hello. Is this Samantha?
Yeah, that's me.
Good morning. I look over and I'm like, well, I know this person. Well, I know lots of you guys in here, but welcome. We're so glad you could join us. My name is Kimberly Ferrier, and I'm the Director of Treatment and Supportive Services with the Montgomery County ADAMHS Board. You will be hearing from me today. You're going to be hearing from our Executive Director today. You're going to be hearing from some of our staff today, and you're going to be hearing from Dave today as well when he talks through the contract process. So there's a lot of information to cover. There will be, all of this information will be on our website, and then we also will have a document that we call the calendar year 24 RFP, and that will be in Word format, so it's not just a PowerPoint presentation, and we'll make sure that we post that to the website as well. I want to welcome all of our providers and people that are on our Zoom call. I think it's great that we can have people in person. But also that we can have you all join us virtually. So I see Jackie and Janelle, we've got Dawn, we've got Carrie. I see my Executive Director Helen. So welcome everybody. We're so glad that you're here. If you are on Zoom, please make sure you mute yourself. If there still does continue to be some static, you may want to look at your computer because it may be the volume on your computer that you need to mute. So this webinar is being recorded for you guys. So that means later, if you missed something or you feel like you want to be able to revisit some of the things that we discussed, that's going to be on our website as well. We also will have FAQ. So please hold all of your questions for the end. If you are on the Zoom call, please put your questions in the chat. Tina Resash will be monitoring that. And if you have questions afterwards, just send an email and we'll go over that here towards the end of the presentation as well, so that we can make sure that we can answer the questions that you have. So we are very grateful that you are here today on this lovely Friday. So I'm actually going to pass it over to our Executive Director, Helen Jones-Kelly. Helen, are you there? Helen, do you hear us?
Yeah, I don't know either.
All right, so if somebody on our team could send Helen a text, I'm going to keep going.
Oh, we're gonna have to mute this when she comes on.
Nobody wants to hear my voice echoing.
Text her.
Oh, Lord. Isn't this working now? This is what we do. We roll with the punches.
Yep.
No, that's not even moving. All right. Doesn't matter.
Okay, hang on.
We carry on.
Got the message that we're ready to get started. I just want to make sure you all can hear me okay, because I'm not hearing anything from the room. Okay, good. You can hear me. All right. And let me know if I'm too loud because I've got my video and my audio turned up. So good morning, everybody. Thanks for bearing with us, especially bearing with me, because I would much prefer to be there in the room with you Unfortunately, I am just leaving a doctor's appointment, which has me in my car talking to you. So I'm going to look for hints from folks if for any reason we lose my sound.
Recording in progress.
I would want to just take the time to welcome you all. As I'm looking at my screen here, it looks like there are at least 79 participants who are on the call with us, either on the call or in the room. We're up to 79 so far, and we know more joining us as we go. So welcome to the rescheduled 2024 Bidders Conference for Treatment and Supportive Services. I think most of you know who I am. I'm Helen Jones Kelly, the Executive Director of ADAMHS, and I'm really glad that you all are taking the time to join us today. We want to make sure, number one, that we are working with you. And there are times when we have to come around some of these hot issues that we're all dealing with in terms of increased numbers. I think it's important for us all to bear in mind that prior to the pandemic, there were people who were not coming forward for services or may have been masking in some ways that have nothing to do with what we wore during the pandemic. Now people are more informed about the resources within our community, and the need has increased significantly in a variety of ways. And you'll hear about some of that as we're talking today. And we want to make sure that we're finding ways with the continuing growth of need, yet the flat funding that we are all currently experiencing, to try to address those needs as much as we possibly can. Thus the importance of this application for funding this year, because we're all in a mode of having to be more innovative and certainly more planful with the way that we're coming around our needs for increased funding during a time when that just hasn't happened yet. The money hasn't caught up to the need. So we're really pleased that we've been able to come around this in some more creative ways to keep our services moving within our community. With that said, I'm going to ask you if you'll mute yourself during this meeting if you are on virtually. We're going to ask you to type your questions into the chat box throughout the meeting. And please know that it is being recorded and it will be posted on our webpage for your review. We're going to go to the next slide.
Advance.
Thanks. So I think you all know who we are. We are an arm of the state of Ohio that operates locally with our county to plan and to fund and to monitor our public mental health and addiction services. We are responsible to the 536,000 community members. And under Ohio law, we are one of the 50 boards, many of our boards are merged, for coordinating public behavioral health and addiction treatment. With respect to our mission, our board came around this mission statement a few years ago, and it's still our relevant direction for how we are attempting to lead with respect to behavioral health services and funding, as well as planning for what needs to happen within our community. And it also aligns well with a number of the initiatives that have come about since the pandemic began. Our vision is a statement in and of itself, in that we want to be able to be part of an inclusive world where optimal brain health equity ensures no one suffers in silence. And I think we all know that for so many years, we've had people suffering and not coming forward. We want to eliminate stigma so that people can come forward and get what they need in order to have sustainable lives within our community. And we'll go to the next slide. So where does our money come from? And most of you who've been part of this service continuum for years know about our human services levy, but there are folks who have joined us today who've not experienced the ADAMHS system for funding before. So I just want to make you aware of how we are able to garner the funding that we put back into the community for the provision of behavioral health services. As you're looking at this particular slide, what I'll tell you is that for calendar year 2023, our budget revenue amounts to $48.2 million. We are representative of a variety of diverse streaming funds. We have local dollars from our Human Services Levy, which is really the core of our funding. We also receive state dollars for targeted services for the most part. It's rare when our state funding is diverse and not tied to some very specific programming. We also receive federal dollars through the state, federal pass-through dollars, as well as having the opportunity to go after grants that operate at both the federal, state, and local level for specific initiatives that we also bring forward into the community. We have come to understand how our funding flows, particularly with targeted funding. And that's an important element that we want you all to understand, because sometimes people see what our budget numbers are, but don't know that very often those numbers are tied to specific initiatives or programs. So for us, they operate in more of a pass-through capacity because they have to go into those particular programs without a lot of discretion in the way that we're able to put those back into the community. We're going to go to the next slide, and I'm going to ask Kimberly to come forward with that next slide. But before we move there, I just want to make sure everybody is aware that this year we're having to be very strategic in the way that we're going to be able to put funds into the community, because we are at the point now where we've been flat funded for the last couple of years. And even though we've been able to go after dollars that allow us to create some strong initiatives, we are not in a position to address a lot of new programming or expansion with our funding dollars, because those dollars literally are flat funded, and the increased need in the community has caused all of us to stretch. So we are in a spend down of our reserves. And that is going to be something I want you to keep in mind as you're listening to all of this today, because we don't have new dollars to put into services. We are working with ways in which to try to stretch every dollar we currently have while we're awaiting some additional funding notices from the state and looking at some other grant opportunities. But this is that time when our team really is going to have to work together. And by team, I'm talking about our entire system of care. One of the things that you may have heard is that we are going to extend our current contracts for another 6 months while we're working towards trying to build more resources that we can put into other programs. So that's an important element to consider as we're moving through the conversation today. And we invite your questions, but we want to be absolutely transparent with you as we talk about how we're going to put dollars into the community for these new 6-month contracts that we're going to be bringing in to our system in the next in this next cycle. Consideration for continuing services, as well as where we're going to be able to collaborate if there are to be new services. So with that said, Kimberly, if you'll talk about our continuum of care and the requirements under which we operate with programming.
Lily, thank you, Ellen. So you can see on the slide up here our continuum of care, and this is all based on Ohio Revised Code 340. And Danielle Zeisloft, who's not here with us today, but she put this together on the slide for me. So it really just shows how we're trying to cover all the way from promotion, prevention, treatment, recovery, all the way through. I have to get this off my chest and say this, that this morning there was an active shooter at Troy High School. The alarm went off. There is no active shooter, but the panic and the children jumping out of windows and the parents and all of the things that happened is a reminder of all the work that we have to do. We have the same amount of resources and we have a greater need. So we are acknowledging that you guys have more individuals that you are serving. We have more crisis, we have more trauma, we have more need, and we are all trying to work together as a team to figure out how to support the community. I've never had 15 minutes more terror in my entire life, but this is what our children are going through, that I'm driving to work and my daughter texts me there's an active shooter. Okay, so now, you know, this is what we're talking about, this continuum of services. And this all ties in with our community action plan, with our strategic plan. The children are safe, the teachers are safe, but this is happening all across our country. And we need you guys to help support the community. We are, in fact, a team. And I just want to thank you guys for all of the work that you do, because it is so needed. So I'm very grateful that the kids at the high school are safe. And I'm grateful that you guys are here with us today. And I just needed to say that because I feel a little weird. I feel a little off, but I'm here with you today because I appreciate all the work that you do. And so we want to move to our next slide then. Oh, thank you, sir. So when I was talking now about the continuum of services that we have, I do want to point out that you will be able to get this information. It's the school again calling. So this is on here. You can go to our website and you're going to be able to find our strategic plan. You also can go and get our community plan as well. That's also on Ohio Moss's website. The great thing is these all tie in together. And so as we're doing all of these different surveys, there's different task forces in the community. We've got the behavioral health task force. We've got the familiar faces steering committee. We've been doing Tristan and her team working with HPIO to look at some of the disparities. And the great thing about this, guys, is you see how it all ties in together, that we have a community that is consistently saying what the needs are. And so it's not all over the place. We're all on the same page with what we're trying to do here. So I encourage you to get online and read some of these. You'll see there's a consistent need around prevention, around support for our youth. We need housing. Housing is always a need, you know, and safe, affordable housing, right? Always looking at how can we support individuals that are in recovery. So please, I encourage you, check these out. You'll see that thread. As in the clinical world, we call it the golden thread. You will actually see a golden thread going through all of these plans as well. Next slide, please. All right, so when you go into our application for funding and when you apply, there are several things that are required. Some of you probably already know this because you may already have an active contract with us. So if you look here for license and accreditation, we require that you have to have one of the following. So that could be being affiliated with NAMI. It could be that you have Ohio Moss certification to be doing case management or the treatment services there. It could be a recovery housing certification. You just need the address or location for that. You could be an educational entity or a governmental entity. So when you go into the application, you will be requested, there will be a question, do you have one of these licenses or accreditations? And if you do, you'll also be requested to upload that into your application. All right, fiscal requirements. Once again, for those of you who've been doing this for years, gotta have a unique entity identifier. You can go to sam.gov. And then you also have to show that you have a certificate of good standing with the Ohio Secretary of State. The links are right here. So if you don't have those things, go to those sites and it'll walk you through how to do that. When you do your application for funding, as you're putting in the narrative for the programs, you're also going to find that you're going to need to upload your insurance. You're also going to need to put in your financial audits. Any budgets that tie into the programs that you are requesting funding for, and then the key performance indicators, which those are from your recent financial audit statements. So right here it says, please review the calendar year 2024 funding priorities and guidelines document for additional requirements. So what I was saying at the beginning when I was doing the welcome is that we do have an RFP. It's not a PowerPoint presentation. It's a Word document that outlines all of these different things so that you kind of have it in front of you and just be able to double check and make sure that you have the items that you need. Here's something fun we're doing for calendar year 24. So take a breath. It's going to sound strange, but I promise it's actually really, really going to simplify the process for you guys. So historically, what we have done for Medicaid type services is that when you go into the application, you're going to put your budgets in. And within that budget, you put in Medicaid type services. And that is part of your application. What we are doing this year, so you don't have to do that because it's a pain. You're not going to have to put your Medicaid type services budget in the application. Not at all. We are going to have a pool of dollars specifically set aside. It is first come, first serve. Here's the good news. Based on our historical spend down, we're actually putting more money into this cost center. It's going to be $7 million for calendar year 24. This will, in fact, simplify the process for you. You will not have to put a budget when you go in and do your application for that. All you got to do is keep enrolling people, and gosh, you're already doing that anyway. So it completely simplifies it. So all those codes and numbers that you would have to put, I see it back here. Thank you.
That is a tedious process.
That's why I was trying to be like, guys, this is a really good thing. Like, I know at first it sounds a bit scary, but we really, as a team, we're trying to problem solve. How can we make this a little bit easier for you guys? So I'm glad to see the old school roof raising in the back. So if you have questions later, that's fine. But basically, you're still going to enroll people in GOSH. These are for individuals who don't have Medicaid, indigent dollars. So we're very excited to see how this goes down because we think it's going to really help everybody out a lot. Next slide, please. Oh, the quality assurance requirements. As so many of you have worked with Emma, she's our new quality program coordinator, and she's waving over here. Just for those of you that are in prevention cycle and treatment cycle, there's always quality things that we need to pay attention to because it helps us to see how the program is performing, what the outcomes are, and then if there are some concerns, our team is always welcome to meet and problem solve with you, which I'm sure some of you in this room have had meetings with us to be like, hey, let's kind of come up with a plan to see what we can do to support this program. Maybe if some of the numbers are a little bit lower. So the quality reporting is for levy funded services. Emma has met with several of you. I've met with several of you. We don't just throw these quality indicators at you. We try to talk with you and say, what's something realistic? What's something you'd like to measure? What do we think the community needs? So we have these meetings and then we come up with the questions together. Or there's been a couple times where ADAMHS came up with the questions. We sent them to you and said, now let's have a meeting. You all look at it and tell us what you think, and let's see what we can adjust. Typically, we'd like those submitted no later than 1 month after the completion of the previous fiscal quarter. Some of you, a lot of our housing programs do monthly reports. So for those of you that are already in contract with us, you'll know that some of it's monthly, some of it's quarterly. This is actually submitted through our ADAMHS portal. So, but this year moving forward, we do have a new system that we are using. It's the same one that you all used through prevention. Emma, can you take 1 minute and share about that really quickly?
Yes. So, hi, I'm Montgomery. Nice to meet you guys. We did create like a new system this year that we're utilizing for both the AFF portal and which where you'll submit your applications, as well as the quality reporting. So for those of you that have already had funding, I've already set up an agency account with you, so you don't have to do that. But if any of you guys in here are a new agency that are going to be contracting this year for the first time, you'll go to the website, which we'll have here later on. There's a slide that has the website on there, but you'll just click request a new McAdams provider portal account, and the instructions are really, really easy. That will set you up. For those of you that have already been funded by us in the past, all I'll need is an email with your primary program contact name, the email address, the primary program contact name's title, and your agency. So I've already got your guys' agency set up. I just need to get the primary contacts in, and that will be the email that all the communications about programming will be thrown through. I also have a separate list of quality assurance contacts, so just keep that in mind that it doesn't need to be the quality assurance contact. It's the primary program contact.
Thanks, Emma. And we'll go more into a little more detail toward the end of the presentation. So just another reminder, and also for some of you, you may be getting emails or have connected with Emma yet again. We're doing our quality performance reviews based on the level of funding that you receive. Those are done either annually or biannually. So we tie in a lot of the things from our quarterly reporting into those quality performance reviews. And I'm going to pass it over to Justine in a minute. She's going to share one of the new super cool things we're doing. We also have e-basis, and that's Basis 24 and Perceptions of Care. And so some of you may be aware of what that is. Some of you may not. We do have most of our providers trained in that, and there's different tiers within that training. So what had historically happened, I believe, is that this was something that started pre-pandemic. When the pandemic hit, it was put a little bit on pause. So last year and this year, we've been reaching out to providers to make sure that they're adequately trained, that they know how to use the service. And then so with Basis 24, that's 24 questions that you have an individual answer at intake. You also do it then 6 months later. You can do it at a year. You really can do it at any time because it gauges some of the things that the individual wants to work on right in the moment. And then Perceptions of Care really just helps us to see how the people that you are serving view your services. Do they like them? Do they not like them? Do they love them? You know, what are some things they think are strengths? Where are areas of improvement? So if this is something that you have never heard of and are actively with us, I would be super surprised, but please reach out to Emma. So all providers will be required to submit a plan on current e-basis status. So that's what we've been working on and Emma's been working on. The other thing I want to remind you guys is that yes, this application for funding process is about funding through the levy. But if you are receiving federal dollars through some sort of grant with the ADAMHS board, it's super important that you stay on top of the GIPRAs or any of the other key performance indicators that are required. And so we've been meeting, Jen and myself have been meeting individually with some of you to make sure those things are happening or to connect you with the necessary resources so that we can get you where you need to be. All right. I am actually going to pass this over to our senior program coordinator, Tazeen, and she's going to share a little with you about some of the steps we've taken in our DEI process. Thank you.
So as Kim said, good morning, everyone. My name is Tazeen Ahmed. I am the Senior Program Coordinator for Health Policy and Equity. My fall allergies are in full swing, so I'm going to try to get through this without choking. But I'm going to keep this pretty simple. We are working really hard to apply a lens of equity throughout the entire behavioral health continuum of care, including treatment and supportive services. And so with that, we are using evidence-based strategies to be able to implement measurable outcomes. So for the application for funding for treatment and supportive services for this year, for the DEI portion, we are going to ask every applicant to complete what we're calling the stages of change assessment. So if you are a current provider, you've actually already been sent this form digitally by Kimberly. And so if you haven't completed it, please complete it. If you need it reset to you, please let Kimberly know and we'll get that form for you. And if you are a new provider or a new applicant this year, please reach out to Kimberly and we'll make sure we get that to you. All the communication will come via email through Kimberly so that it's from one person to the person you identify at your organization. That way we're not losing any communication. Upon completion of the stages of change assessment, there will be 6 domains that we're going to look at, which is organizational DEI commitment, policies and procedures, leadership and infrastructure, training, clinical care and community engagement. And these are matched up with the national class standards. And from that, we are going to provide and help develop at least 2 to 3 SMART objectives and measurable outcomes for you to be able to incorporate within your programming. We ask that you adopt, or we require that you adopt at least 2 SMART measurable outcomes as part of your program for this upcoming fiscal year.
Perfect. The only other thing I was going to mention from that slide, thank you to we do also, last year we started working with providers on some of the motivational interviewing, some of the mental health first aid or expert training. So for this year, for those of you that went through the application for funding process, we just would like for you during the application process to share how many of your staff were able to get trained in some of these. We realize that certain trainings may not be applicable. So for example, I think the mental health first aid training is phenomenal and it benefited me to go through that. However, the preference really is that you get some of your supportive staff or individuals that are unlicensed to start to go through this first. So it's not that, oh, I've got alphabet soup after my name, I can't benefit from this. No, it's great. Like, it really helped bring it down for me to be able to be like, you know what, stop being so clinical and just sit down and here's some ways you can intervene. Just be human, you know, just relax a little bit. So I think it's a great training, but if you're looking at and you're feeling overwhelmed, like, oh my gosh, how are we going to get all of our staff trained in mental health first aid and expert and motivational interviewing, just take a deep breath, look at where you're at, and sit down and maybe identify a handful of people this coming year that you're like, they could really benefit from some of these trainings. So it's really just about having that extra support for your staff and for our community. Okay. All right, our priorities this year. We're continuing to focus on continuum of crisis services. We were awarded $3 million from SAMHSA. That's broken out $750,000 over the course of 4 years. That is specific to our continuum of crisis services. We did have several people that offered letters of support who will be involved, and then we will be reaching out to those individuals. So if you saw a press release or anything that was talking about those $3 million, those dollars have already been allocated to the providers that are working with us on that. Inpatient access, we know that's continuing to be a concern. Through the state, we have access to wellness dollars, which is also a multi-system adult that is trying to help support some of the programming with our familiar faces that we have in the community. We know that we need a little bit more in that area to help support those individuals so they're not funneling so much in and out of the emergency room, the hospitals, the jails. I know some of you providers, I could say some people's names and you'd be like, oh, we know who that is. So we're really trying to figure this out. Housing is always something that we're looking at. Kaylin, she's our new program coordinator for housing. Oh, as you were seeing, that's
I just finished at the door.
Okay. So Danielle Zeisloff, she's our assistant director of behavioral health services, and she is the right and left hand of Tristan and myself. Yes.
I just commented the sound is gone.
The sound's gone. You guys can't hear me? Can you?
Okay, and others can hear, so it looks like it's just Dr. Robinson.
Okay. All right. Dr. Robinson, we'll try to see if we can get someone to call or figure out how we can support you. Thanks for letting us know. I don't know where I was at. Housing's always a need. I was introducing Kaylin and Danielle Zeisloff. She's the Assistant Director of Behavioral Health Services. So Danielle and Kaylin have been working on some capital worksheet projects that we can be able over the next 2 bienniums to support some additional housing projects in the community. So more to come on that because we've still got to get our ideas submitted to the state. Jail and forensic services are always a top priority, and that ties into some of the work we're doing with familiar faces, the work we're doing with the sheriff's office, with City of Dayton, the 36 police jurisdictions that we work with. Lots of awesome things happening, and we're always looking at wellness and recovery supports because we are aware, if you go back to that initial continuum that Danielle had put on the PowerPoint, it's really the whole person care. We can't just look at one thing, it's everything. I do want to mention we are not looking to expand services though. As Helen mentioned in the very beginning, we will be extending calendar year 23 contracts flat funded for 6 months. More to come on that because I know there's questions popping in your head right now. Housing. So some interesting things have happened with housing in the past couple months. There's this new thing where for RSS, so for residential staff, for those enrollees are now getting $1,600 per month. It was $1,200. This is something that what the state has said, so don't quote me on this, but this is what the state has said. This is a dollar amount that should have been increased since like the 90s.
Wow.
So this increase is not increasing the level of service or level of care. The care that these individuals are receiving stays the same. It's more of that extra support for the providers who are working in residential care facilities to be able to kind of write something if they're correcting something that should have been happening for 20 years. Let's bump it a little bit. One of the things we've come into though, these dollars only apply to RSS residents. These do not apply to non-RSS. And what has happened is that rent is being increased to match that 1,600. So that's not actually what's supposed to be happening. There's going to be another meeting that Kaylin, what meeting are you going to be at?
The housing committee?
Yeah. When is that?
I think October 13th. If anybody wants to join, just let me know after.
Yeah.
I'll send you an invite.
Touch base with Kaylin. She's going to be going into more detail about this, but I just want you guys to be aware that there is administrative law code and an Ohio revised code that this increase for RSS is only for RSS individuals. So if you are then increasing the rate for non-RSS, ADAMHS board will not be covering that $400 difference. So this potentially is a bigger conversation that Danielle even started with the state. What's the plan for this? Because we have places that are raising rent, right? It's only supposed to be for RSS, not supposed to raise rent. So we will be having more discussions. There's going to be more meetings, and we are open to the dialogue and even pulling in some of the individuals from the state. Let's see if there's anything else. Just wanted to mention that. No changes with recovery housing. So just wanted to be able to share that. Kaylin, did you have anything to add? No. All right. She's started this and dove right in. So a couple other things we want to talk about. So as we were looking through all of the programs that we have, Tristan, how many total programs does ADAMHS board fund?
Right now I found 167.
Thank you, 167 programs. That's wonderful. That's all the great work that you guys are doing. So when we're looking at though, we were realizing maybe we need to have some targeted work groups to talk through how we might discuss standardizing this a little bit, because I don't always see a consistency in what we're doing. And so now it's a great time to get some people together that would be providers, ADAMHS staff. We're even going to pull in people with lived experience. We want to know what you guys have to say. We want to be able to talk about it. So be on the lookout over the next 6 months for some work groups around housing, supported employment, and other supportive services. All right, let's talk about continuation of funding. Maybe some of you have already thought that because I said, oh, we're just gonna go 6 months in flat fund from calendar year 23. So treatment and supportive services is gonna reopen in April for the final 6 months of calendar year 24. The timeline will be posted on our website. Okay, so the treatment and supportive services application for funding will return to our regular 12-month cycle for calendar year 25. In the meantime, you're going to be doing an application now that'll be due, I believe, October 20th of this year. You're then going to put in a budget in calendar year 24, April 24, to wrap up the final 6 months. You will have 99% of your application already done. So we'll reopen the application so that we can finish out that calendar year. So I don't want you to panic and be like, oh my goodness, we're gonna have to redo the entire application. Tristan, am I correct in saying that their stuff will be saved and they can add to it?
That's an Emma question.
That Emma, am I correct?
During the application?
Yeah, when we reopen it in April. Or is it gonna?
As they go through it?
Mhm.
Yeah, it saves, sorry guys. It saves as you go through it. Just make sure you're clicking next and you're not jumping from section to section, because if you don't go to the bottom and press save, it will not save. So when you're filling out the sections, it's kind of set up in like a box format. You're gonna jump through them, but you're gonna press save at the bottom.
Right, so I want you to know, it's not gonna delete everything to where you then have to do the whole thing over again. You're doing your application over the next month. And then you're gonna pop in, we're gonna reopen it for the final 6 months of calendar year 24. I do wanna make it very clear, we are deliberately maintaining the distinction between our treatment and supportive services and our prevention funding cycles. This, what we're talking about right here, only applies to treatment and supportive services, not prevention. So I just wanna make sure that's clear, because some of you in here are in both of our funding cycles. At this time, I'm gonna stop talking and I'm gonna pass it over to Dave.
Thank you.
Thank you.
Morning all. So I'm here for the fun stuff, the fine print, the legalities. But before I get started, my name's Dave Holbrook. I'm the Director of Administrative Services, so I don't see you all that much, but I'm behind the scenes. And the key person in the room that you need to know is Chandra Hightower. So Chandra, stand up. Chandra is our contract administrator. So she's the one that's actually touching your contracts and processing them. So she's important. Thank you. So I wanted to just talk about a few things. And again, it's the fine print, it's the things you need to understand about the insurance. But this process right here. So the first circle talks about when it's due. I think I heard October 20th. Is that true, Emma? October 20th is the deadline? Okay. So make sure you get your application in by October 20th. If you miss that box first, there's not a whole lot we can help you with. So you need to make sure you meet that. And then we need to talk about how that flows through our system here. So we take a recommendation and we recommend it to the program and services trustees. That's our board. So we meet the second Wednesday of every month. So we take it before them and ask for their approval based on what you send us and our recommendation. Then the board approves, right? And then the contracts are sent for signature. So that's that process. Now, as we get into the contracts, we need to talk about how those requirements are, and some of that's already been talked about, but it's looking at the Ohio OMAS, the assurance statement as part of the contract, make sure that's there. Need to make sure that there's financial audits in there. And this is, if you're here and you've been here before, this is something that's happened in previous years. If you're new and you need some more information, if you want to stay afterwards, we can talk a little bit more and get you in touch with somebody. So also we need to talk about the insurance, the liability insurance. And you see there, the amount has to be at least 1 million and with an annual limit of at least 3 million. So that's important to make sure you understand these numbers, or your contractor, your finance folks understand this. So you can take back these slides. They'll be available online and share that information. So we want to talk a little bit more about the guidelines and the insurance. Again, this is just the fine print stuff that you need to make sure you meet. This is easy stuff to just make sure you're checking off. So again, the professional liability insurance, the employer's liability insurance, making sure that's there, a minimum amount of 500,000. Automobile insurance provider to make sure that you do have that. Workers' comp, making sure everybody has workers' comp insurance, and the directors and officers insurance. These are all key elements because this is something you want to make sure legally you have so that if something goes sideways, we can make sure this is in place. Okay. So this is my last slide, but I've been given direction. I have to read something word for word. So it's important that you hear this, and it's important you see this slide. So this is a statement. ADAMHS reserves the right to reject proposals and/or funding requests less than the requested amount. You all are aware of that. Any entity that receives ADAMHS funding will enter into a contract with ADAMHS. Prior to any payment of allocated funding, all funding decisions are final and are contingent upon the receipt of allocations from the Ohio Department of Mental Health and Addiction Services, otherwise OMAS. Okay. So again, I wanted to make sure these are key slides that you just make sure the important thing is making sure the application's timely. That's the important piece. Okay, if you have any questions or if you want anything, we can talk afterwards. We'll hang out for a few minutes if you want, and I can give you some contact information. I can give you Chandra's number. All right, Emma.
Hi again. Just reiterating kind of what we talked about earlier. Like I said, we do have a new portal that we're utilizing this year. If you've already been in a prevention cycle, you've already been using this portal. It's called CBrooks. It gives us a lot of new capabilities that we're really excited about to share with you, as well as like data analytics. So it's a good change. I know change is scary, but it's a lot easier to use than our last portal. So for those of you that have had contracts with us in the past, I'm going to need, that's my email up here. We'll also put it in the chat for those on Zoom. Your name, agency, primary agency's contact, and that email address for me. Also want to reiterate that this is not your quality assurance contact. This contact is going to be responsible for relaying any messages that are about application for funding or any just communication that we need to have directly with the agency onto your staff. So this is that primary point of contact. Next slide. And then if you guys have been in the funding cycle, this is irrelevant to you. Like I said, I've already set up provider portal accounts for all of the agencies that we have had in the past. If you are new, this is going to be like the link to that new portal, CBrooks, and there's a button, just say click for a new portal access, and it's like 3 different steps. It's very easy to set up. So, but I've already set one up for you guys, so you don't have to worry about that. Thank you guys.
We're rounding the finish line, y'all. All right. Just want to go over a couple things on the portal. So applications will not be cloned this year, meaning for treatment and supportive services, you will have to, this next month, put everything in. When we hit in April and we reopen it, it's all still going to be there, okay? So, but for those of you that were using our old portal, our ADAMHS provider portal, that's not going to be copied and put into this new portal. So you are going to have to put everything in there fresh. Then the second 6 months, you'll be cool, okay? So I'll be good. Just keep in mind, any uploaded blank documents without prior permission from me, you need to reach out to me and say, hey, this is why we need to leave this blank, or why, whatever you may need, whatever need there is there, you need to reach out, talk to me so that we can figure out what's going on. Because if you submit the application with a lot of things left out, it won't be considered for funding. So we need to talk through this. Make sure agency contacts are up to date. This is the perfect opportunity to look at all of your staff, your CEO, your CFO, your COO, your quality, your client's rights officer, and make sure, we know that there's been turnover, we know there's been workforce issues, but this is a great opportunity to make sure we have the best contact information for you guys, super helpful. So make sure you double check that. I do want to let you know that if you're inactive for 2 hours, meaning you navigate to a page and don't click on anything, the portal will automatically log you out. So make sure that if you're done, you save everything and you log out. Make sure to submit your application on the finalized page. Make sure you resubmit it. So if we reach out and say, and you've submitted it, I say, hey, William, let's have a meeting. You know how this goes. I'm gonna open it back up. He goes back in, he does the corrections and resubmits it. And it may not even be a correction. It may just be something that we wanted somebody to add. So the other thing that I do want to mention is our timeline. So Monday, September 8th, you're going to email support@mcadamus.org with point of contact, or you can email Emma. Yep, one of the two. Monday, September 18th, I said 8th, but all of this will happen on the 18th. Emma's going to offer a training on how to navigate the portal. So be on the lookout. Did you already send the invite for that?
I have not.
So be on the lookout for that. We will be sending the invite for that today. And what we will do is send the invite to the people that attended today. And then Tina, should we include the CEOs?
Yes, we absolutely can. And I feel confident we will post that. Is everybody familiar with the black pop-up box on the bottom right of our homepage of the website? If you go to mcadamus.org, there's a black pop-up box on the bottom right. We're going to put that information in that box so you can access that first thing Monday morning. What time is the training? We haven't set it up yet. Okay, watch for that black box. Thank you.
Personal online.
It'll be online.
We wanted to gauge what you guys were wanting. So if you guys think morning or afternoon.
We will also record
Yeah.
that. We'll record that. We did that for prevention as well. We recorded that training and put it on our YouTube page. So if you are unable to attend via Zoom on Monday, we'll put it on our YouTube page for you.
Thanks, Tina. So Tuesday, September 19th, the applications will be available and open at noon, so you can start working on those. And then Friday, October 20th is the submission deadline. Those are due by 5 p.m. Late applications will not be considered for funding. And then October through November, we will be reviewing the applications and sending notifications as needed. But look at pretty much doing flat funding at this point. So it's going to be that 6-month extension of the budget that you have for calendar year 23. We're going to be trying to flat fund that for 6 months into calendar year 24, unless you've had outside conversations with myself or Tristan or a meeting with some of my staff. So, all right, next slide. Questions? The FAQ and PowerPoint will be posted on our website. All other questions can be directed to Emma, and she will funnel those to myself and Tina so that we can add it to the FAQ on our website. Or I might just give you a call and we can talk through it. But either way, if one of you has a question, it's probably a question that multiple people have. So we'll make sure we get that on the FAQ for you. And now we go to the fun part of questions.
Can I throw something in there really quick? Hey guys, you guys might have seen an email from me about the provider satisfaction survey. If you've taken it already, I want to let you guys know it is a lot shorter than it used to be. We really reduced the length so that we can receive more like feedback from you guys. We really do use that survey. We meet quarterly internally to discuss the answers. They're completely anonymous, and we do implement changes based upon your feedback. So if you guys are the ones that receive that, as it goes to like the CEOs and then the primary contact, please forward that on to everybody in your agency that works with ADAMHS so that we can get as much feedback as possible. But we did reduce it. It should take like 2 minutes.
We heard you. We heard you.
Okay, question in the chat.
Yes.
What do you mean by first come, first served allocation of Medicaid type services?
Perfect. Great question. First come, first serve means that when the money is done, it's done. However, something to remember is we've increased this allocation amount. This cost center, the amount of dollars in there is more for calendar year 24 than it has been any other year. So although it's first come, first serve, please be aware it's additional dollars. Yes,
Can I just add, we're breaking that into 6 months, aren't we?
correct.
This 3.5 million for 6 months, 3.5 million second 6
Correct.
months.
Thanks, Tristan. Did that answer the question? Helping? Is that Dave?
Dave, is that good? Does that help? Anything else? That was the only question in the chat. I know Kimberly's good, but come on.
Come
There might
on.
be one or two more questions.
Y'all sharing the love today. You know, I'm always open to discuss things later as well. Open door, open phone, open email, we'll figure it out. No, everybody's good.
No additional questions online.
So we want to thank you guys so much for joining us and hope you have a wonderful rest of the day and enjoy your weekend. Thanks, guys.